Most likely way is that your doctor will protect their license and their reputation, and they will say it's not FDA approved, therefore I cannot recommend it, I cannot endorse it, I cannot say anything about it. And then the other doctors will say exactly the same thing, but I can tell you for sure it works because there's now 117,000 trials on stem cells completed, and you don't complete 117,000 trials on anything if it doesn't work.
Hello, friends. Thank you for tuning into this week's episode of the Mayn Idea Podcast, where today I have the pleasure of sitting down with Gideon Krausz and Dr. Adrian Robinson. A brief disclaimer. I am not a medical professional, and to some degree, I lack the expertise to host a conversation about stem cell research. However, I am curious about stem cell treatment, its risks and benefits, as well as its specific application to grappling and combat sports. Given the proximity of the facility and its potential to help local athletes in the San Diego area, I wanted to host this conversation. I will aim to have a critic of stem cell research on in the future to help balance the delivery of information. If you love this podcast and want to support it, please take 30 seconds and leave a 5-star review on Apple or Spotify and subscribe to the YouTube channel. This helps the show get discovered organically and helps me continue to bring on amazing guests. The other way that you can support the show is by sending your favorite episode to someone who loves jiu-jitsu. Let them become part of the community and learn from some of the greatest minds in the sport. Dr. Robinson is an expert in regenerative medicine, anti-aging, intra-articular joint injections, and acupotomy. Gideon Krausz is an executive with 30 years background in business, leadership, and healthcare. I hope that you enjoy this episode as much as I did. Without further ado, Dr. Adrian Robinson and Gideon Krausz. So, gentlemen, thank you so much for taking the time out of your busy schedule and the launch of the clinic in Tijuana. I want to thank you both for joining me here.
Great, thank you. Good to be here.
A pleasure.
So before leading into the episode, of course, there will be an introduction, but I figured given the variance in expertise, why don't you both take a minute and kind of explain a little bit about your careers and what led you to this position to come together to launch this facility and help take care of some of the best athletes in the world.
Very good. I'll let Dr. Robinson start off with that.
Well, I've been working, I graduated in 96, so I've been a long time as a physician, working with stem cells for the past 8-10 years, working on alternative medicine also around 15 years now, and doing Acupotomy, doing neurotherapy, ozone therapy, different other areas of the alternative world.
Very good.
And Gideon?
I was living in Singapore, and I was in the green technology business, and my friend had just bought a business in Thailand called Global Stem Cells, and asked me if I wanted to go and run it because I wasn't really that busy. So I looked into the stem cell technology and was very excited about it. I actually had a shoulder injury from sports that I had an operation, and it was okay, but it wasn't 100%. So I said to my now partner, if you can fix my shoulder, I'll join the business. So I had a stem cell injection into my shoulder, and 2 months later it was 100%, and so I said, great, I'm in. So I moved to Thailand, and we started with the stem cell business there in 2013.
So if we kind of zoom out here for a little bit and talk about the athletic side of things. So that's my background comes from a history of skiing, tons of knee injuries, tons of low back lumbar injuries, tons of joint injuries. And through monitoring and watching different athletes that I look up to my whole career, you see a lot of athletes hit this point where they're flying to Colombia, they're flying to Mexico, they're going overseas, they're leaving the United States, and they're seeking these alternative solutions to pre-existing issues that they have that they can't seem to recover from. So maybe we can start really by addressing the elephant in the room, in that the United States is not regulating this for treatment, right? But you're seeing it in other places in the world. what are some of the reasons why you see the legislation greenlight this, like somewhere in Thailand or in Mexico, and how you're able to service these athletes, yet we're still running into those problems in the United States of getting these kind of things regulated for use?
It's a combination of factors. The most important, sadly, is the financial availability of profits for the companies that would have to invest in navigating the U.S. regulatory system. Every modern democracy has a set of health regulations, and if you want to provide a health treatment of any kind, you have to go through their regulations, you have to go through their process. It varies from country to country, but they're more similar than they are different in general. And the US has just been caught up in this 50-year quagmire of double-blind, placebo-controlled phase 3 clinical trials, which cost $1 billion. And the only way in which any company would be willing to spend any kind of money getting these kind of processes and drugs and treatments approved is if they can make their money back. And it just so happens with stem cells, very difficult to patent, very difficult to control. And so there just isn't enough financial incentive at the end to get the treatments approved.
And Dr. Robinson, from your perspective, how effective, I can imagine where the answer would go, but how effective are stem cells? What are some of the, maybe you can steelman the case for why you would not want to use them, and also give some examples of their effectiveness in treatment of athletes, of general population, and why this is an emerging and successful area of expertise that we should really lean into and hope for regulation approval in the United States.
Yes, I mean, one of the reasons is because stem cells basically repair damaged tissue. Therefore, these type of cells, whenever they need to go in our body, they will start repairing all that area. They get a signal from the body and they need to reproduce these cells. Therefore, once the patient has those cells in the body will start using them. They are basically cells that they have this potential to become whatever our body needs to repair. There are some limitations, like if there's a herniated disc or there's a really tear ligament or a tendon that it needs to be physically repaired with the surgery or so, stem cells are not going to be able to work. But the other areas, most likely stem cells are going to be working into that area because our body needs it. We constantly are reproducing stem cells because our body is constantly changing, and that is the important part of the stem cells.
So if we take, for example, I recently went and had an MRI performed, and there was a C5, C6 herniation from jiu-jitsu, and then also a T3, T4 bulge out the side, which was creating this referred pain underneath my scapula. Would that be a candidate for some sort of stem cell treatment where you can localize the injection and the treatment to that site, and then, like Gideon explained earlier, have that pain alleviated that you've been dealing with for a long time? Or,
We can work
what's
it out.
the use case?
Yeah, we can work it out. Part of it. I mean, there's some studies that I need to address and check out and see. I mean, how the problem is that I need to check it out. But most likely, part of it is okay. Herniated disc. The body creates this fibrotic tissue. By creating this fibrosis, it is difficult for stem cells to either go into that area and repair it. Therefore, most likely it won't work that well. In those situations, we use a different technique called Acupotomy. It's a part of our acupuncture treatment that liberates that fibrotic tissue. By liberating that fibrotic tissue, a lot of times we're able to expand the pressure that between one vertebra and the other are causing for that disc to bulge out. Right. By liberating that, we're able to expand it, and that way we can treat partially the herniated disc. Then when we apply the stem cells, whatever damage is done into that area, the body will repair it.
That sounds like an amazing experience. The amount of just day-to-day pain that this creates. And I think this speaks to probably a lot of the listeners and some of the people that I already know have come into your facility with Dean Lister and Brandon Moreno, in that as a grappler, as a fighter, you're constantly dealing with some level of pain, in that you're fighting all the time, right? This is not yoga. It's hard on the body. It's tough on the joints. There's a lot of compression. There's a lot of flexion in joints where you want extension and extension where you want flexion. So you see the wear and tear on these athletes over time is so substantial. NFL football players, right? People with a lot of impact in their sport. When someone like a Moreno or a Dean Lister comes in and they have this lifetime of wear and tear on their body, what is the use case for stem cells for someone like that, and what can the expected benefits be? Because I feel like that's really where the listeners would probably slide into that group of people, where you're doing everything that you can, you're exercising, you're strength training, you're doing all the right things, yet there's still this nagging pain in different joints that just build up by the fact that you're doing grappling sports and you're doing combat sports.
Yes, I mean, it is, the body creates this fibrotic tissue in order to help us out. And by creating these fibrotic tissue, because, they're created because what you mentioned, all the grappling and the lesions that the fighters get, so the body tries to repair it, but it will not create another piece of tendon or another piece of a ligament or more part of this muscle, It will create this fibrotic tissue that by being created limits the flexion, the mobility, and even the stability of that muscle. Why? Because it becomes harder. It's the end piece of it that becomes harder than when the fighter is doing, the sport or even fighting. He doesn't have that motion, that elongation part of the tissue because of the fibrosis. That is one of the problems. And the way we address it over here is, like I mentioned, Acupotomy, because we cut in part of the fibrotic tissue, then allowing it to expand. Then when we use the stem cell therapy, that expansion of the area, the stem cells can start working in going into places that without it wouldn't be able to reach.
And if we look behind you, right, there's a hyperbaric chamber. I know that there's several offerings within your facility. And Gideon, when you were thinking of maybe conceptualizing this idea, right, and bringing it down to a facility where people can actually come in and get several different treatments, what caused you to select and choose the different things that you offer?
The most important by far, are the stem cells themselves. And we're looking to add features that can, in the case of hyperbaric chamber, can activate the stem cells. So the pressurized oxygenation throughout the body participates in activating the stem cells. Whenever we can, if a patient can get in the hyperbaric chamber after the stem cells, that's great. The Acupotomy was a happy coincidence because it's not that common. The study of that is mostly restricted to China, and so Dr. Robson just happened to have that skill, so it fitted in very nicely. We have a 12-room spa, Medi-Spa, so things like lymphatic drainage, massage can be helpful. So that's something that's useful. And then the other treatments we have, ozone therapy, some anti-aging treatments. They're all useful and they all fit in. But they're bells and whistles. The most important by far is the stem cells and the quality of the cells and the consistency in manufacture and handling and administration of the cells. That's by far the most important. The rest is icing, 5%, 10% at max.
Maybe we can dig on that for a moment. You mentioned handling and the care. what would you say is something that differentiates your facility and really puts the credibility behind it in this handling and care view versus some of the other places in the world that may say or claim that they're providing that level of care but aren't?
Yeah, well, when you asked me before about regulations, I didn't expand fully about what's happening in the US. And if I tell a little bit about that, that will probably help to lead into what's important about our facility and our clinic program. So there are two main sources of stem cells. Either the stem cells come from yourself, usually from fat tissue, or from bone marrow, from a bone marrow. They call it an aspiration. Sounds really painful, but actually it's not. It's a needle that goes in usually to the hip or some other large joint, large bone, and extracts the bone marrow. It's fast. It's like a 20-minute procedure. So that's one source of stem cells. The other source of stem cells from the patient's own cells are from fat. Now that is something that was quite popular in the US about 10 years ago. We stopped using patients' own cells about 8 years ago, and independently, my partner here in Mexico also did the same thing, unless someone absolutely insists, usually for religious reasons. Perhaps they're a Jehovah's Witness is a common objection. Then all of our patients receive donor cells from a healthy donor. Now, what happened in the US was the FDA came after the doctors 10 years ago, and the doctors pushed back and said, we're using the patient's own cells, it's not a drug. Because it's not a drug, it's not FDA, it's nothing to do with you. So lots of lawsuits backwards and forwards. About 4 years ago, or maybe 4 years ago, let's say, possibly 5, the FDA said to all the stem cell practitioners in the US, you need to get together, you need to record your data, you need to standardize your programs. We'll give you 3 years to do it. If you don't do it, we'll shut you down. And sure enough, they didn't do it, and the FDA shut them down. So probably 90 to 95% of all the gray stem cell practitioners in the US that were there was probably about 400 to 500 8 years ago. And now there's probably 20 or 30. And they're operating on the sort of outskirts of what the FDA allows, and they won't advertise, they won't put any signs up, and when you get in there, they'll say, oh, do you want some stem cells? Now, the problem with that is if it's your own cells, then the processing is not that difficult, but there are risks to it, especially local infection. Not a huge risk, but a risk. But if you're using donor cells, this is where the problem has arisen in the US. Completely illegal, completely unapproved by the FDA, always has been, and for the next probably 5 or 10 years will be, not allowed by the FDA. But the universities got together with doctors, and there's something called a institutional review board, which is essentially a clinical study. So what a lot of universities were doing were partnering with a doctor, offering a paid clinical study, and then providing donor cells. And there were, at one point, maybe 15 laboratories in the US that were doing this. The FDA has cracked down a lot. Most of the universities have said, we don't want to touch it. The point of the whole story is that producing high quality stem cells is expensive and requires a lot of investment. Because the industry was never stable enough in the US, the US cell quality has never been as good as it is outside of the US, because the business isn't ongoing. You know, we have an ongoing business in Mexico, in Colombia, in Panama. Actually, Ukraine was one of the world leaders of stem cells, unfortunately, and also in Germany and in India. They're the sort of main areas where there's been significant investment. So for our clinic, the cells are under our control, so we select the donors, we do the liposuction ourselves, we do all the screening, we isolate the cells at our bank in Guadalajara, and those cells are checked and cleaned, and the immune response ability of those cells is adjusted so that there's no risk of rejection. That's the standard process throughout the world. And then they're frozen at minus 80 degrees centigrade until they're shipped to Tijuana. We have our own bank here where they're kept at minus 80 degrees. And then when the patient needs them, we just need an hour and a half's notice to bring them up to temperature, to usable temperature. And if you look under a microscope, the cells are alive, they're moving around. All of our batches are tested for everything you can think of. So there's no risk of rejection, there's no risk of infection, and it's just a very simple and easy process where these cells, we just order them, and an hour later we inject them into the patient. But our company controls them from beginning to end, and that's very hard to find anywhere else.
So if we talk about this procedure of extraction, you said that one opportunity is that you're going through your own fat tissue or your own bone, right? And you're extracting the stem cells and then using them on yourself. Where are the other stem cells coming from?
The difference between using your own cells and using someone else's cells is just a difference of whether it's you or someone else. The source of the cells from the donor is the same, but in our case, we use mostly fat tissue.
But those are the donor is a deceased.
No, they're live,
they're
healthy 20 to 22-year-old, genetically screened for every possible mutation, and no diseases, as healthy as you can find. And we actually select that person. It takes about a year before we find someone. They need to be tested ongoing, and then we use their fat, and that's where the cells come from.
So I mean, since we have the time, I find this really interesting. So on the donor side of it, is this something where, like when I was in college, I remember that you could sign up for these studies, right, where you go in and they basically hook you up to an IV or something like that, and they monitor you for 24 hours. When you're a broke college student, it's great because they pay you, $500 or $600, and you essentially are a lab rat. So for these donors that are qualifying based on this criteria, they have no genetic mutations, no likelihood for rejection. Are they're completely healthy, voluntary, going, and they're signing up at a facility that's like a stem cell bank essentially? And
It's a free liposuction. That's what they get.
Got you. And then those are extracted, stored, and wait. And while they're stored at this negative 80 degrees centigrade, that basically freezes the cell in exactly its same state until you want to bring it up to temperature, correct?
Exactly. Actually, there's a bank in I think it's somewhere in Switzerland, and they banked cells. It's now 28 years ago, and every month they defrost them and test them to make sure that they're okay. So we know that the cells can maintain full viability for at least 28 years, but it's an ongoing experiment.
So whenever I hear stuff like this, I just start wondering. I'm like, what's the downside? What's we have an outlier case, right, in that everyone reads about. I mean, do a cursory search on stem cells in the United States, and you're guaranteed to find this article that happened in Florida, where people received stem cell injections for some sort of malfunction in the eye. Several people had a contraindication, or they got sick from that, and then they went blind. And this was one event, I think, with 4 people. I may be misquoting that, but you read that, and that's very impactful, right? It's scary. It makes you second guess it. How many cases are there like that? And maybe on that same talk a bit, since you've opened your facility, have you ever had an instance in which a patient's body did reject the treatment?
Right. Okay. There's a few questions there. The last question first. No. Stem cells are immunogenically privileged. Part 1, and part 2 is in the manufacturing process. The success of the advance of treatments with stem cells is probably 2002, 2003. The process of desensitizing the surface of the cells so that there's no antigens for the immune system to interact with means there's no rejection. So I hired a stem cell doctor in 2013, immediately when we went to Thailand. He was living in China, and he had been responsible for 17,000 cases, and he brought all of his data with him. And then since then, we've done many, many thousands ourselves, and we've never had a single case of any immunogenic response that is significant enough where it's any kind of issue. In fact, if you have an organ transplant, as you know, from a donor, then the use of stem cells to limit graft versus host disease is now in studies, so that the stem cells actually stop the rejection rather than anything else. But that's of an organ. So in our case, we've never had any negative issue. In terms of the downsides and the too good to be true kind of thing, the whole of the what we were talking before about the FDA and phase 3 clinical trials and spending $1 billion and all of that, the reason that system is set up partly benefits the pharmaceutical companies, but it also benefits the general public as well. And in the last 50 years, if you look at almost every medical breakthrough, then that breakthrough has side effects. It has things that can alter. And the reason is that most of these medicines, almost every drug, almost every medicine, in some way inhibits or interferes or changes, or if you have high cholesterol and you take a statin to reduce your cholesterol, then it reduces cholesterol by stopping the body depositing plaque inside the arteries. It actually interferes with that process. It doesn't reduce your cholesterol at all. The statin doesn't reduce your cholesterol. It interferes with the body's process. Now, when you interfere with anything that the body does, often there's a price to be paid later. And you see drugs that get recalled 10 years later, 15 years later, sometimes for really big issues, like formaldehyde, or sometimes for small things. But the molecules and the science and the drugs and all of these pharmaceutical creations, they have downsides. Stem cells are the exact way in which the body repairs itself, and when you have a transplant of stem cells, taking someone else's stem cells, it just so happens by biological determination that there's no risk, there's no downside, there's no side effects. The worst thing that can possibly happen is you don't get as good a response as you're expecting. And that is the exciting and amazing thing about stem cells, and that's why there's more than 7,000 clinical trials going on right now all around the world on all the different uses of stem cells. But we're in the early commercialization, and we actually treat patients. We've been treating patients for 10 years, and we're constantly amazed. But there's almost no medical treatment you can find of any kind that has no side effects. Every operation, every drug that you take has a list of side effects, sometimes including some pretty severe ones. But stem cells they just happen by biological design to be easily accepted, and the body takes them in, says thank you very much, I needed those, and gets to work.
And Dr. Robinson, maybe you can speak on this, the embryonic stem cells and stem cells in general. Where's that division, and are they the same thing? Because I know that morally that seems to be a spot where people get a sticking point, is the idea that you're getting an injection from a fetus that's no longer alive is very disheartening.
Yes.
So what is that, the different options for where they come from, and maybe you can just speak a little bit on that moral dilemma, embryonic stem cells, stem cell treatment from the medical view.
Actually, so maybe I could jump in on that one.
Yeah, go for it.
No clinic anywhere in the world in the last 20 years has ever used embryonic stem cells for anybody. You couldn't even find them if you wanted to. There were embryonic stem cells used originally for research, and in some situations there is some small use of embryonic stem cells but all the cells that we use in every other clinic are adult stem cells. An adult stem cell means when the baby is born,
Right.
the cells are already mature. They're not changing. So it's just that it's just doesn't exist.
Umbilical cord can be used, we can use the blood from there, from the fat, from the bone marrow. Those are the typical ones that we use, okay? We have to understand this. Why is the importance of stem cells? Stem cells are cells that they have not become in anything yet, but they have the potential to become the cell that the body needs. They can transform into an eye cell or a lung cell or any other tissue that the body needs. Therefore, by having a healthier cell in your body, this is the thing, the accumulation of cells creates tissues. The accumulation of the tissue becomes an organ. The accumulation of the organs is our whole body. Therefore, if we have good cells in our body that are constantly changing and reproducing according to our needs, our body is going to become healthier.
Sounds good to me. I wonder where that comes from, though, because that's a sentiment, right? That's a sentiment that a lot of people seem to have, even if it's unfounded. When did that start to become the narrative around this?
Well, it's never been anything else other than that. It's just a few, it's a bit of press here and there, and people like to have shock news, and embryonic stem cells are completely irrelevant in all aspects of commercial treatments.
See, I think this is a really important talking point, because many people that I've come into contact, and myself included, been in athletics my entire life. The perception many times is that that's what this is, right? That stem cell treatment, period, is embryonic stem cells, and it's a moral issue to get treatment. And there's just not an understanding of the fact that everything that you just said, that these are voluntary donors, they're screened prior, they're stored properly, they're brought up to temperature properly, and then administered in professional facilities all over the world by people that have integrity in the business and what they're trying to do. Yet many individuals have the perception that that's not the case. And so it's very important to clear up the narrative around that, because as this gains more steam, not that it hasn't globally, but I mean, FDA approval on this kind of thing would be massive, right? That's not only is it a massive opportunity for individuals seeking care, athletes seeking care, but also for business and in healthcare and in the progressive future of healthcare offerings for people. Outside of conversations like this, how do you think that stem cell research and stem cell treatment can start to begin to gain better understanding of the procedures themselves amongst individuals?
It's always driven by consumer need. It's always driven by that and nothing more. So when people realize that they can go to another country and get stem cells, then they do, and then they talk to their friends, and that's how that's how things progress. I mean, of course, we do our best to communicate the most important aspects of coming to Tijuana for treatment. One of the things that we haven't mentioned is we have a federal government license specifically for stem cells. It's called a Medicina Regenerative, regenerative medicine. And there's only 10 clinics in Mexico that are retail clinics like ours that have the license. There's about 28 licenses in the whole country, but some are with banks, some are with hospitals and research institutes. But for terms of commercial clinics that treat the general public, then there's a very small number. So the Mexican government 5 years ago recognized that stem cells were one of the most important health breakthroughs, and that most places in the world they were getting pulled down in old style of regulations. And it was actually my partner here in the clinic, He's a plastic surgeon, and he was a former head of the FDA for Mexico. He went to the Senate with the legislation, with all the studies, and spent 2 years getting regenerative medicine, getting stem cells legally approved in Mexico. So when someone comes here, they can see a copy of our regenerative medicine license. It's fully regulated, fully licensed, and fully controlled. We have a lot of reporting that we have to do on our protocols and all of the batches. Every batch of stem cells is recorded. Every batch comes with a certificate for the patient, and so all we can do to answer your question on education is getting out there and telling people this is how it works. And the most important thing is that whatever you can find in the US, we're better, we're more experienced, and we're significantly cheaper because that's all we do. In fact, we're just building a new laboratory in Guadalajara, which is 5 times the size of the current one, and that's only to produce stem cells.
If I'm an individual and I go to, I have enough qualms with the healthcare industry in general, having been an athlete my whole life seeking care. And if currently there's not FDA approval of stem cell, if I go to my doctor, general practitioner, for some sort of pain and I'm looking for a solution, usually they're going to try to prescribe you medications, right? Prescriptions, which you alluded to. You listen to the commercials and they go, side effects may include, and then it's a list of things that ends usually in death, right? So there's plenty that can go wrong there. How will I get a recommendation in the United States to then know that I actually might need to come down to your facility?
It will go 2 ways. Most likely way is that your doctor will protect their license and their reputation, and they will say, it's not FDA approved, therefore I cannot recommend it, I cannot endorse it, I cannot say anything about it. And then the other doctors will say exactly the same thing, but I can tell you for sure it works because there's now 117,000 trials on stem cells completed, and you don't complete 117,000 trials on anything if it doesn't work, because you don't get past the first 20. And the other point that you can try and get out of your doctors is the FDA, most doctors, they know that stem cells are effective and that they're safe. And if they weren't, then it would be completely shut down, it would be completely outlawed, there'd be no IRBs, there'd be no anything. And if you were doing something that was actually damaging people, there's no way the FDA, there's nothing that the FDA let go on that damages people, ever. So it's almost like an implied thing, and they're just looking for ways in which, the FDA are looking for ways in which they can accelerate approval. But when you go to your doctor, you're rolling the dice because the vast majority of US doctors are stuck in a medical system that doesn't really cure people. It doesn't look at root causes. All it does is keeps people sick and the money train rolling. And so there's definitely a conflict of interest. And we hear different things. Some doctors say, yeah, it's great, go for it. Most doctors will say, don't do that because I can't stand behind it because the government won't let me.
So now let's assume that you're someone who is in the United States. We'll use the grappler as the example, given the podcast. You're a grappler. You don't have health care. You're experiencing some kind of pain. How does that person begin to interact with your facility and start that process?
Right. Well, we have a website that explains the treatments, the options. It has quite a lot of FAQs on it. Where do the stem cells come from? Are they safe? On there, it will say in big red letters, we do not and have never used embryonic stem cells, just in case people have that perception coming in. So we would always encourage someone to have a look at the website and just see some general aspects of how the treatment works. There are plenty of testimonials there and on Instagram. You know, we have dozens of testimonials on Instagram, so that will get people to understand a little bit about the process and all the rest of it. And then contact us. We have six patient coordinators, all of whom are trained very, very thoroughly in what stem cells are, how they work, what different indications, what each patient can expect, in what cases we may not be able to help them. So what we'd encourage someone to do is to contact us and ask their questions, and then after a short process, then they'd be passed on for a consultation to either Dr. Robinson or one of the other doctors that deal with stem cells, and we'd explain the treatments and book them in. The great thing about most of the treatments is that they don't last more than an hour, so people can do same day. There's very little downtime. The only thing that we do say is, because the stem cells are prepared individually for each patient when they're ordered, then the patient does have to pay for the cells before we deliver them, so that otherwise they can get wasted. They need to be used within a few hours.
Is it possible to stack treatments if someone was making the trip down from San Diego, for example, and they wanted to make the most use of their time? Are you able to do stem cell treatment, hyperbaric chamber, kind of stay for the day type thing? What
Absolutely.
is the clinic experience on that level?
Yeah, that's a good question. So we also pick up in San Diego. We have transport service. Some people have no problem driving to the border and walking across. Some people have no problem driving in. Some people are a little bit reticent, and so we pick them up and bring them in. And when they hear, they say, "Wow, this place is just great." Not just the clinic, but Tijuana in general. We're downtown in the middle of the business district. We got HSBC Bank on one side, AT&T on the other. We're 1 block from Costco, so it's a pretty developed and safe part of the world, even though some people are a little bit concerned.
And the food,
but
is so good.
Yeah,
the food in Tijuana.
I don't know if you saw. I don't know if you saw my interview with Dean Lister.
I did. Yeah.
When I said to him, "Do you feel safe coming down here?" He was like,
I mean, hey, if Dean Lister doesn't feel safe, I definitely don't feel safe.
Well, I was talking about his girlfriend, so that was.
Oh, gotcha.
So yeah, so that was quite amusing. So what usually happens is patient comes down, they'll finish the consultation, get some acupotomy, order the stem cells, have a massage, get the stem cells, then a hyperbaric chamber, maybe a reflexology, depending on where the cells are going in. And many people bring their companions, so the companion can have a massage, facial, Botox and fillers are also very complementary to the facial stem cells that we do. And so, people spend a whole day here. There's plenty of good places for lunch. We're very central, secure parking. So it can be as short as 30 minutes, or some people stay 3-4 days. If we get the opportunity, then there's a treatment called chelation, which removes heavy metals via an IV drip. If someone can stay 2 or 3 days, then we can prepare them with high doses of flavonoids, and we can do chelation, and then do the stem cells on the 2nd or the 3rd day. They can do up to 10 days of detox program here. We have a full detox program, but that's only a minority of people.
Right.
The majority of people want to come in, spend a couple of hours, relax, get a massage, and be on their way.
So if we hone in again here on the grappler, Dean Lister is the perfect example, right? That guy's an absolute monster. He's an accomplished world champion. He has put his body through the absolute ringer in so many regards. When I think to teammates, viewers, listeners, other people that I bump into within the world of grappling, most common things that you hear about in terms of complaints and things that people seek to improve in physical training, strength and conditioning, cervical issues, whether that be something like what I have, which is a C5, C6 herniation, or stingers, compression, anything from the head driving into something or getting kind of sprung back, and then lumbar issues specific to grappling because there's so much spinal flexion and extension constantly against your partner. And then knee problems, right? ACLs, MCLs, PCL. There's so much torsion in that joint that it's not that it always tears. There's many people that suffer like a meniscus injury or ACL injury, but it's not a full tear. Where along that spectrum of injury does stem cell really function the best? And if we're thinking of other people in the San Diego area, right? I'm in Encinitas. There's such a concentration of combat sports athletes, grapplers, jiu-jitsu practitioners, judo players that are here that many don't have health care but train so frequently. What is the best case for them? What's the incentive for them to come down? What does
Sure.
that kind of treatment
Sure.
look like for them?
Well, stem cells have multiple properties. They have four main properties, which are actually extraordinary because any one of the single properties is already incredible. But you have to understand that stem cells are the building blocks of life. Stem cells are what creates the differentiation between all of our different organs and everything about our body. It all comes from stem cells. So this incredible capacity that they have across really quite different and distinct aspects of biological function. It's worth mentioning because then that will answer your question. Yeah. So the most obvious and easy one is, meniscus tear or ACL, PCL, MCL, a direct joint injection of stem cells. We also use exosomes, which are like a byproduct of the stem cells, and we add them together because it increases the healing capacity and the sort of size of the army. But direct joint injections to the joint that is causing the problem is the cleanest and most clear application. And the stem cells can differentiate into the cartilage and tendon cells and muscle as well. They also have the property of supervising the healing process. So that they're like generals that tell the rest of the healing process what to do, but they also go in there themselves. So that's the second property. The third property, probably the most important and little understood by the layperson, is they have incredible anti-inflammatory abilities. And all pain, all disease, it's all inflammation. Everything is inflammation. And so these stem cells, yes, they're repairing by sending repair signals and sending actual workers to fix it. Yes, they're differentiating into the cells, and yes, they're splitting themselves and increasing the number of healthy cells that are coming into the area, and they have the anti-inflammation. But this anti-inflammation property is even more interesting for the areas like the lumbar areas where you have bulging discs and you have herniations, and areas where there is damage and there is pain, but it's not necessarily a tear to be fixed by a specific injection. The fourth property that stem cells have, which is not relevant in this case, is immunomodulation. They are incredibly good at adjusting, modulating, and balancing someone's immune system. And that is extremely important in other types of use of stem cells. But when we're talking about orthopedic use of stem cells, then it's the three aspects that I mentioned. So what we typically find is someone will come here and say, right, okay, let's do both knees, my left shoulder, my right second finger, which was damaged, and they'll get direct injections to all of those. Then when we go to areas like the lumbar region, cervix, those kind of issues, then it's a little bit less clear as to what specific repair or adjustment the stem cells are going to make. and we'll tend to say to someone, look, let's do some small injections of a few 5 million stem cells in a few different areas, and let's look for the inflammation to go down and be regulated. And if you're lucky, then some of the micro tears, the stem cells may get in there. So we're extremely confident, and almost 100% success rate, 95 plus on joints, any kind of soft tissue tear. When you talk about the more complex areas where there's compressions and that, then we'll say to someone, pretty good chance that you're going to get some positive results, but we're not fixing anything specific, and so better to sort of adjust your expectations and still do it, and that's the basic use. I haven't talked about IV use. We haven't really talked about IV for stem cells. Maybe we'll discuss that in the next section, but that's the most common usage.
And Dr.
fighters.
Robinson alluded to that a little bit before with the cervical spine stuff, and it can create space within the disc, but it's kind of it's not as pinpoint, right, as some of the other areas. So you're still going to get a benefit, but it's not as crystal clear as if it's, let's say, a knee joint, a finger joint, a wrist joint, something like that. When, let's say someone has, I'm just trying to think of the experience for someone who's coming in with pain, and I guess for this example, we'll assume that it works to the degree that you want it to work to. Is this they come in, they do the treatment, they leave with reduced levels of pain and more function in the joint? Or what is the return after they go through the treatment, or if they do multiple, like you just said, and maybe they do a couple joints? And then on top of that, how long can they expect for that improvement to last before they need to do another injection or change the way that they go about their day-to-day lifestyle?
Yes, all depends on the damage that the patient may have, and sometimes we do several joints. Like Mr. Gideon mentioned, also a lot of times we do, on top of that, we do IVs, because also start repairing internally, so they get also a good response after that. Usually stem cells will last, or their peak or maximum expression will be around a month and a half, 3 weeks to a month and a half to 2 months. That is the maximum ability of the stem cells to start reproducing and start doing their action. So patients, not only they have to wait all that length of time in order to see the effect of the stem cells, they see it pretty much right away. They start feeling less pain, less inflammation, and if they do it in conjunction with Acupotomy, they can right away see the mobility of the joint, and they see good results right away.
There's a bit more to it that I'd like to add as well, because there's recovery, and everyone wants to get back into it. So we did Tim Elliott, the UFC ranked fighter. Sorry?
No, I was joking. I was like, who's that? It's awesome that you guys are getting these top-level guys in there. It's amazing.
So we did Tim Elliott's knee. He was back in training 10 days. We said to him, don't, but these guys, they don't listen. They need to do it. And he did really well. A typical pathway would be first 10 days might get some benefit. As Dr. Robinson says, a month and a half is maybe 2 months. That's when continue, and then in month 2 to 3 you might get some additional benefit, and very occasionally in month 4 something additional happens as well, and then that level that you've maintained of repair, that will last until you do something to wear it out, and depending on your training regime, if you're training really hard, then you could be looking at every 3 to 6 months training away the benefits. If you're basically, let's say, a professional athlete. If you're a keen amateur, then you may easily get a year to 2 years. If you're a regular amateur, then you're looking at 3 to 10 years of maintaining that benefit before you start to get back in and wear it out and all the rest of it. So we would very often get 5-8 years of maintained pain reduction or elimination. But if someone's training super hard, they might get 6 months, maybe a year.
It definitely seems like the grappler, the combat athlete, is kind of the extreme use case because it's so intense all the time and it's so much wear and tear through multiple different movements. Whereas if you're a sedentary individual and you have some joint pain and then you go and do a procedure like this, I would imagine that that's going to last you quite a long time because the activity on the joint is pretty low to begin with.
Yeah, even if you're working out regularly, but when you're stressing to the maximum, then that's when but it's still worth doing because those gains couldn't be made any other way. Number one. Number two is if you don't do it, then you're starting from an inferior position, and it's just going to get worse. So considering the low cost of our procedures, someone who is in any way professional, then the cost is negligible. Someone who's a keen amateur, well, if they're spending $3,500, once a year to keep themselves in out of pain, then it's probably a good deal. Someone who maybe isn't that well funded and is really aggressively training, maybe trying to break in as a professional or something, then they might think that twice a year was probably too much.
Is it possible to differentiate between PRP and stem cell injection if we speak maybe to knee injuries, as they're so common in these sports?
PRP is the poor junior cousin of stem cells. So PRP is a blood treatment, and blood has some stem cells and it has other growth factors. And PRP, all you do is you take blood and you spin it and you concentrate the platelets to usually 6 to 8 times the level that you have in regular blood, and that's your platelet-rich plasma. So that has some healing capacity. I had that on my shoulder in 2003.
No luck.
Works fine, but it in relation to stem cells, it's approximately 1/6 to 1/8 of the healing power. So really no comparison at all. In certain cases, PRP can be good in combination with stem cells, but really with the stem cells and the exosomes, we don't even bother with PRP. Additionally, in the US, US healthcare generally is overpriced, but PRP, doctors will charge between $500 and $1,500 for a PRP procedure, and the true value of that procedure is centrifuge, blood, spin, inject, $150. That's what it should cost, And so we generally advise against PRP because most people will be grossly overpaying for it, and in relation to stem cells, then it's just we don't bother with it.
We had it's out of pocket, first of all, almost unanimously, and I was considering this for my knees actually about 2 years ago, and the out of pocket cost was $350 per knee, and the likelihood that it's resolved is, it's like a dice roll. There are no promises to it actually improving the joint. I've had people that have done it, and there's some that claim absolutely no change at all, some that claim some change, some that claim longer change that then falls off. But then there's the element of, is it really actually working, or is there the placebo that you went through and you did the procedure?
Right, it really works. PRP heals, no doubt about it. It's just like I said, it's weak source when you have stem cells and exosomes as an option.
Subaru, Ferrari.
Yeah. The thing is this, plasma-rich in platelets is totally different than just stem cells. Stem cells are the ones who want to become a potential cell that needs to be repaired. Plasma-rich in platelets, those are already cells that they already started developing something. Okay, so yes, they get benefit. I mean, don't take me wrong; they are good in certain situations, but we cannot compare the PRP into the stem cells. They're totally different.
I feel like if some sort of way you can facilitate a partnership with the UPI that they're building in Tijuana, you will have such a tunnel into amazing business, because there are going to be so many more athletes, in the addition to Yair Rodriguez, in the addition to Brandon Moreno, Alexa Grasso, all these people that are going to be right there in Tijuana training at the absolute peak of their careers, and having these kind of resources nearby potentially could be game changing for them to be able to train more frequently, train more intensely, and stay on top of their game. Whereas other athletes in other places, if they don't have access to that kind of treatment, then it's a disservice to themselves. Do you guys have plans of integrating relationships with them, with the UPI, UFC? Is that possible?
Yes, very much so. We already have a good relationship with the UFC. We're not allowed to publicize and use their logos and name,
Right.
but we are approved for stem cells for their fighters.
That's incredible. Well,
Yeah.
gentlemen, I want to be respectful of your time. As someone in San Diego, I'm tempted to come down and do the little trip. It's awesome that the facility does provide that kind of transportation and experience for people. So I hope that this helps with the exposure, and I really appreciate you taking the time to be on here and talk about treatments, because we're all pushing our bodies to the limit constantly, and having alternative ways to heal and to progress are really important.
Very good, very good. Well, thank you very much, and we look forward to hearing from any of your listeners.
Absolutely.
Pleasure.